I'm going to talk in this lecture about the Schedule 20 herbs, formerly known as the Schedule 3 herbs. And I'm going to focus on the actual herbs themselves, leaving the explanation of what Schedule 20 is for another time. I'm mainly going to talk about internal use of Schedule 20 herbs, and specifically the ones that are in common use. There are a few that are still listed, which very few herbalists actually use. Adonis vernalis, pheasant's eye, which is a cardiac tonic. Quebracho, which is an anti-asthmatic. Meadow saffron, Colchicum autumnale, which is very difficult to obtain, specific for gout, and I've yet to meet a herbalist who's used it. Schedule 20 herbs have very specific effects. These are the herbs that are most like conventional drugs in their action, really quite pharmacological. And you'll see that across the range of Schedule 20 herbs there's quite a wide range of permitted doses. Used internally as antispasmodics, anodynes, cardiotonics, cholagogues, antiallergics, amongst other things, and they're used generally when nothing else will do. 3 of the Schedule 20 herbs are in the Solanaceae family, the potato or tomato family. In decreasing order of potency, these are Atropa belladonna, or deadly nightshade, Hyoscyamus, niger, Henbane, and Datura, stramonium, or thorn apple. Looking at Atropa first, it's cold and dry in its actions, a nervine sedative, antispasmodic or spasmolytic if you like, anticholinergic, so it's a parasympathetic blocker. Its principal active constituents are tropane alkaloids, L-hyoscyamine, which converts to atropine on drying, and hyoscine, which is sometimes called scopolamine. The anticholinergics work by blocking the neurotransmitter acetylcholine by interfering with its receptors. And anticholinergics are also called acetylcholine antagonists. There are similar functional groups between acetylcholine and the tropane alkaloids. So these alkaloids block the acetylcholine receptors. There are 2 types of acetylcholine receptors: the muscarinic receptors, which are generally found in the parasympathetic effector nerves, and the nicotinic receptors, which are found in the sympathetic effector nerves. Tropanes are anti-muscarinic agents. Back to Atropa, the main applications are for reducing visceral spasm, bronchial spasm, and reducing Parkinsonian tremor. And the maximum single dose of a 1 to 10 tincture is up to half a mil, and the maximum weekly dose is 10 mils. And the tincture route is slightly different dosages. Atropa is contraindicated where there's tachycardia, prostatic hypertrophy, where it can cause strangury, which is a painful condition where you have the urge to micturate, but you can't actually pass a decent flow because of obstruction. The ileum of the small intestine can become obstructed. Atropa can make glaucoma worse, and its action will be accentuated by any antidepressant drugs. So toxicity, you look for a dry mouth, difficulty swallowing, dilated pupils, photophobia, and then getting more serious, slow heartbeat, bradycardia, leading to a fast heartbeat, tachycardia, stertorous breathing, and finally confusion, delirium, and death. So if you suspect an overdose, then the first thing to do is summon trained help without delay. Call for help. While waiting for paramedics to come, give emetics or tannin-rich drinks, keep the patient calm, put them in the recovery position, and in time when they get taken into casualty, they may need a stomach lavage. Henbane is similar to Atropa but milder, and it's got specific action on the vestibular nerve. Similar constituents but different proportion. So it's useful in urinary spasm, again reduces Parkinsonian tremor, and very specific in Meniere's disease and motion sickness. Can be used for asthma and whooping cough, and it has pain-killing properties used topically. Slightly bigger doses allowed than Atropa. Datura is milder than either of the other two. Has similar actions to Atropa, but it's less constipating and it's less drying to the secretions, which is that's one action of the parasympathetic blockage. Datura has a stronger action on the respiratory system, and again you'll see that principal constituents are similar. Dosage, again 0.5 ml is the maximum single dose, up to 10 ml a week, and it's principally used for asthma. Chelidonium majus, greater Celandine, is a cholagogue and antispasmodic, so at the same time as promoting the flow of bile, it actually reduces the spasm of the bile duct so that obstructions can be overcome. It's also used topically as an antimicrobial for warts, for tinea infections, and for treating eczema. The active constituents are isoquinoline alkaloids. It's contraindicated in pregnancy, but you note the dosage. You can give up to 10 ml in a single dose, so it's much milder than the other Schedule 20 herbs. Peruvian bark is so named because Jesuit missionaries brought it back from the New World in a early ethnopharmacology exercise, and it was introduced widespread as a specific treatment for malaria, and it's still used today in the form of quinine. Cinchona bark, the alkaloids within cinchona bark are up to 70% quinine. It's also antispasmodic, can be used for muscle cramps and rheumatism, and the dose is fairly permitted dose is fairly high. Contraindicated in pregnancy. If you have large doses of cinchona tincture, it can cause a gastroenteritis. There is a syndrome resulting from the overuse of isolated quinine called cinchonism or quininism, where you get ringing in the ears, nausea, visual disturbances, skin eruption. This is unlikely to happen if you stick to the therapeutic dose of cinchona bark. Lily of the Valley is a cardiac tonic applied in congestive heart failure. It has cardiac glycosides that have actions similar to the Gnetales glycosides, but it's milder in its action and less toxic because it doesn't accumulate in the same way as the digoxin. Maximum weekly dose 24 mils. Start off with a low dose of 0.3, each dose building up to 1.2 mils. Good idea to make sure the patient has plenty of potassium because of the diuresis and subsequent potassium loss, and Convallaria is contraindicated in tachycardia. If you've had too much Convallaria, you're likely to feel sick, throw up, have diarrhea and get intestinal colic. Ephedra sinica, the Chinese name Huang, is in the order Gnetales, which puts it in the same family as Dennis dog. It is a central nervous system stimulant, an antispasmodic and an anti-allergic herb. The main application is in the symptomatic treatment of hay fever, asthma and allergic symptoms generally. It's also used for respiratory infections, particularly in traditional Chinese medicine, but because it's really quite heating and stimulating, it's best restricted to those patients who are shivery and cold and just cannot mount a decent heat reaction. So lung qi restraint with cold. You can use it similar to Sudafed for clearing sinuses, but in distinction to Sudafed, it doesn't have just one alkaloid in, it's got a range of ephedrine alkaloids which have a variety of slightly different actions. So it stimulates the alpha receptors, increasing the blood pressure and pulse, but also stimulates the beta receptors, and that's where the smooth muscle relaxant effect comes in. You can give up to 48 mils of this a week. Don't use it if somebody's hypertensive or hyperthyroid, if they have glaucoma, and if they're just excitable generally. And never use it if the patient is taking monoamine oxidase inhibitor drugs. Gelsemium is the most potent of the Schedule 20 herbs in terms of dosage. Note the maximum single dose, 1/4 of a mil, not 0.25 mils, which is equivalent to about 4 drops of a 1 in 10 tincture, and it's the route that is used. So you can use up to 5 mils a week. The main applications are for trigeminal neuralgia. Other facial pain will respond to that nervine sedative action, and I've heard of people using it for period pain. It also very much slows the heart and is hypotensive, so avoid if there's cardiac disease or low blood pressure, and it will accentuate the symptoms of myasthenia gravis. If you've had too much Gelsemium, you're likely to experience the 4 Ds: dizziness, double vision, drooping eyelids or jaw, and dilated pupils. And a frank overdose of Gelsemium will result in respiratory failure or death quite quickly, within about 17 hours. So emetics, stomach lavage, strong tea, rest and warmth are required. And obviously, if you suspect an overdose, summon help without delay, similar to Atropa. Lobelia inflata is a relaxant antispasmodic and also a respiratory stimulant and expectorant. It's ideal for those constricted conditions of the respiratory tract, like in asthma, pertussis, where there's bronchial spasm and congestion of mucus, because it can release the spasm and eject the mucus. Lobelia is also a balancing agent for the autonomic nervous system. It contains an alkaloid lobelia, which is in the same family as nicotine, so it has been used in some smoking cessation therapy. Maximum weekly dose is 32 mils. Large doses are emetic, and in fact